Compliance presentation by Jayson Ravago, HCA 322, Healthcare Ethics and Medical Law. My instructor is Professor Keita Davis, February 6, 2018. Moving right along. Good morning, Board of Directors. The focus for this meeting is to talk about the following: moral right to healthcare, code of ethics, Stark law, and medical malpractice. Moving right along, morals within the healthcare. We're going to talk about 4 items: who is qualified to medical care, what procedure are implemented, establishing funding appropriation, ensuring that we as medicine and healthcare service providers are satisfying our promise. Being in medicine and healthcare specialists, we are expected to comply with all guidelines that are taken into place for better of our patients. Patient health and wellness, as well as personalized healthcare, is our primary job. In regards to the legislation and policy, I strongly believe code of ethics, resource allocation, and Stark regulation are the absolute most essential. In this particular discussion, we will amplify a little bit more specifically. Code of Ethics. The Code of Ethics mandate the medicine and healthcare service provider to execute the following. We see to it that they are managing to keep individual health and wellness relevant information confidential, guaranteeing honesty of medical care related information. Within the healthcare arena, there's certainly a primary bioethical basic principle, and they are as follows: autonomy, understanding to become cautious and considerate of others' individual preference, as well as the ability to uphold the action no matter what your personal consideration. Number 2, justice, principle in which originated from John Rawls. This pertained to the patients being treated equally right across the board in spite of personal point of view. Last but not the least is non-maleficence, the act of staying away from induced, deliberate, or perhaps unpremeditated injury for the extension of life or technology. Now let's go on to the Stark law or Stark legislation. The regulation was launched and designated after the lawmaker Pete Stark. This particular policy would certainly guarantee that healthcare professionals were conducting right by the patient. This regulation prevents any type of healthcare professional through self-referring on their own or any one of the friends and family for treatment, which consequently would amount to individual and personal financial gain. They will not be in a position to benefit from state and federal government-funded insurance provider. This particular legislation came around 1989, soon after research study documentation generated information that medical professional escalated use of the referral system, in which demonstrated they have some association in which led to personal financial profit for medical professional. Moving right along. The second topic that we going to talk about is medical malpractice. Certainly, there are a variety of different questions of health-related negligence in which can occur in a medical facility. Within some of the circumstances, this particular can certainly leave either physician or healthcare facility in jeopardy for a medical malpractice legal action by the individual or family members. The restriction of which implemented for the safety and security individual or particular patient are also the very best interests of healthcare professional. So, in conclusion, moving right along. In conclusion, over the course of the healthcare compliance maneuver, a substantial role for the medicine and healthcare service provider, it really serves to help the facilities. One, the patient believe that they are essential, which establishes confidence, and one in a particular patient can certainly get the word out to the whole entire community, can certainly profit from it. I feel confident that in my short and sweet analysis of this compliance report has explained to you a specific thing concerning our ever improving system. From a program to become effective, it mandates various improvements and reforms. Throughout the upcoming years, I do not anticipate a lot of significant adjustments. I strongly believe there certainly be a small scale policy adjustment at some point. All creases will be certainly straightened out of the universal medical system. We have a lot of individuals that have made up money and they will remain to deal with that transforming system. Um, Thank you very much for the board of directors. This concludes my presentation.